Hey guys, it's Jenny on the block, and today I'm here with Dr. Che from our Cosmopolitan Dermatology.
Yes.
So, where are you guys located?
We are right in Cleveland Heights, 2323 Lee Road.
Awesome. And how long have you been open?
We've been open for the past 3 years.
3 years.
Mhm.
Okay. And what kind of dermatology do you guys practice?
So we do all of dermatology. I mean, I see for babies to adults, my oldest patient is 99, my youngest patient is 6 months, right?
Oh my
so
gosh.
we do everything, but one of the things we're really well known for is hair loss.
Oh, okay.
Yeah. We have a lot of patients who come to see us from all over Northeast Ohio for hair loss.
Okay.
Um,
So, what kind of hair loss solutions do you offer?
So it really depends on the kind of hair loss you have. Most people think of hair loss as a diagnosis. It's just a
Right.
symptom. So you could lose your hair from stress, where you shed a lot.
Yes.
Or you can lose your hair because of your genetics. If you look at your parents or grandparents and they're thinning and you start to see thinning in you, it's genetic.
Okay.
In fact, that's the most common type of hair loss. So our goal when you come to see us is to do, the physical exam, the lab work, and make sure that we diagnose you with the right type of hair loss,
Okay.
and then treat you appropriately.
Okay. So, it really depends on what is causing it.
Exactly.
Okay.
Depends on what's causing it. Whether it's some people come in with an autoimmune disorder.
Okay.
Yeah, and your own body can attack itself, and it can attack your hair in little circles called alopecia areata.
Okay.
In fact, the word alopecia just means hair loss. It's not really
Oh.
a diagnosis.
Oh.
So some people come to me and they're like, "Oh, I have alopecia," but that doesn't tell me anything other than you have some kind of hair loss, right?
Right. Okay.
So it's my job to figure out which category of hair loss you have so that we can treat you appropriately.
Okay. Now, once you have that diagnosis, what are the options? I know, I've seen people with, toupees, and I've seen the commercials with the hair loss for men. And
Yes.
so tell me a little bit about how you guys actually
Approach it.
tackle that. Yeah.
Very good. So once I do labs, I sometimes do a biopsy, and once I come up with a diagnosis, let's say you came in and you end up having autoimmune hair loss, alopecia areata. You present with these circles of hair loss. I will do some steroid injections,
Okay.
and then I can add some vitamins as well, and then we add topical steroids. If you have, genetic hair loss, something we call male and female pattern hair loss, that's the most common type of hair loss people have. It's not just men that go bald, women do too.
Yes, I know.
And it's very, very, very disheartening and debilitating. If I diagnose you with that, we have a completely different type of treatment.
Okay.
We put you on some vitamins. We consider a topical treatment called minoxidil. Most people know minoxidil as Rogaine. Right?
Oh, okay.
So we use Rogaine and quite a bit, and then I may put you on a pill called spironolactone that helps to tamper down the hormones that make you lose hair.
Okay.
But our latest and greatest treatment now is something called platelet-rich plasma. I've had a lot of patients come in and ask about that.
Yeah.
It's very exciting because in the world of hair loss, there aren't that many new treatments, right?
Very true.
Yeah, and so this newer treatment it has a lot of promise. It's very natural, meaning I'm not pumping steroids into your scalp.
Okay.
We draw your own blood, and then we spin it and get your own body's natural growth factors, and then we inject it into your scalp. And it seems to work very well, specifically for those with male and female pattern hair loss.
Okay. So there's genetic, and then there's alopecia.
That's from the autoimmune.
Autoimmune.
Your immune system kind of attacking itself.
Now, what about something like stress?
Yes,
Can
very
stress
good.
cause hair loss?
Absolutely.
Okay.
That's, in fact, one of the more common reasons people shed. So if you're stressed out, let's say you're having a hard time at the job, or you lost a loved one, your body can be so traumatized that your hair starts to shed.
Okay.
All right, and what is the difference between that and just thinning? You put your hands through your hair, hair comes out. You comb it, hair comes out, and it's just coming out in chunks that you never experienced before.
Okay.
And it's very, very scary.
Yes.
Okay? Because you don't know what's going on.
Yeah.
And the good news is, once whatever the stressor that caused it goes away, your hair goes back to normal.
Okay.
It's not a forever type of thing.
Okay.
Right? But it is very, very scary, and that kind of hair loss can be not just stress related also. If you're having problems with your thyroid, if your hormones are off, You know, sometimes even people with anemia, low iron levels,
Mhm.
those who go and get lose a lot of weight very quickly can shed a lot of hair. So
Okay.
there are medical causes of the shedding, and we call that telogen effluvium. That's a diagnosis I would give you if you came in and said, "Hey doc, I'm shedding so much. What's going on? Do I have cancer?"
Right.
99% of the time, you do not have cancer. Cancer is not the main reason why people lose their hair.
Okay. And as far, you said stress related isn't normally something that's going to be an ongoing problem once the stressor is gone.
Exactly.
With the other types of hair loss, it is usually a permanent.
Exactly.
But then what you're doing can help restore? Is that a good way to say it?
Yes, yes. So, if you have male pattern hair loss, that's the common balding that you would see in a lot of men. And women have it too. You see the lady who's in her mid-50s
Right.
has thinning hair, right?
Right.
That is permanent. I mean, not permanent in the sense that you can't do anything about it, but there's no cure,
Okay.
right?
Yes.
So the treatments we give you can restore some of that hair and give you your dignity.
Yes.
But you're going to have to continue to do some kind of treatment to keep it, because your body wants,
Your body wants to get rid of it.
Exactly. Just like most other medical concerns, like if you have diabetes
Mhm.
and you take your medicine, you live a normal life, right? Your
Right.
blood sugars are controlled, but if you get off of that medicine, voila, it comes back because we don't have a cure for it.
Gotcha.
The same thing with these types of hair loss. It's genetics. It's in your blood. We can't change your genetics, but we can certainly make your hair loss much better.
Gotcha. I'm trying to look at some of these comments here and it's not coming through. Hang on one sec, guys.
Okay.
Oh, it says I have to get Facebook on my coworker's phone. He doesn't want it. But I'm gonna let you have this so you can try and get Facebook app on your phone. If you guys do have questions, obviously leave them in the comments. Dr. Che will be able to answer those after the fact because I'll give her the link. But baldness, I know, or not just baldness, but losing your hair can really cause an issue with self-esteem. So have you seen a lot of changes in people that you've helped combat the problem?
Absolutely. In fact, a lot of my patients will go see doctors about their hair loss, and then other doctors will be like, "Oh, that's nothing," or "You have plenty of hair. What are you talking about?" Right?
That's not what you want to hear.
And that's not what you want to hear. And it's especially, I know men are concerned, but women especially, because our hair tends to be part of our our makeup as beautiful.
Yes.
Right?
Yes.
And so I had one patient I'll never forget. She ended up having breast cancer.
Okay.
Right? And she had chemo and lost all her hair.
Mhm.
Her breast cancer was cured.
Oh, good.
But she was depressed and, just, overwhelmed by the fact that she lost all her hair. She
Yeah.
would travel from Kentucky to come see me in my
Oh, wow.
practice. Yes.
Wow.
And because of her hair, she was a Southern gal. Her hair was everything to her,
Uh-huh.
and the cancer robbed her of it.
Yeah.
And her cancer doctors told her, "Well, you're cured. I mean, you're doing well with your cancer." But that wasn't enough for her. I mean, she felt like her identity was robbed.
Yes.
That's how much hair loss means to people.
Yes.
It's part of your identity,
Mhm.
We know what's on the inside is more important, but what you present outside is how people see you.
Yeah.
And often what we've been trained to, see ourselves as.
Yeah.
So, even though hair doesn't kill you, or hair loss doesn't kill you, it really impacts your quality of life.
It really does.
Yeah. And I've had middle-aged women come in and seek some kind of hair loss treatment because they're getting out there in the workforce and they feel like, I have to look my best. I'm competing with 20-some-year-old girls, right? And so they come and get treatment so that, they feel confident in going out there in the workforce.
Yeah. Wow, that's awesome.
Yeah.
Now, you said you treat all ages.
Absolutely.
Is there anything, do children ever have issues with hair loss that you can treat?
Absolutely. The autoimmune hair loss called alopecia areata tends to happen in children. In fact, my youngest patient is 3 years old, and she's lost all her hair, completely bald, eyebrows, eyelashes, everything gone. And of course, this 3-year-old is playing around. She doesn't care, right?
No, 'cause she's
But
3.
She's 3. Her parents are devastated. This is their first child. They think they did something wrong. They think it's their fault. And it's her immune system literally like attacking her and all the hair follicles on her body.
Yeah.
So kids do get affected. The hardest time for kids is my teenage kids,
Yeah.
right? You know, both boys and girls, they come in, you know, they have patches of hair loss. My male patients will wear a hat all the time or want permission for me to, you know, write a note to school so that they can wear their hat because you know, they're not allowed to wear the hat, it'll expose their hair loss. And then the girls, I mean, can you imagine?
No.
And
High school is hard enough already.
Absolutely, absolutely. And people think they have cancer, you know, and they don't.
Right.
It's just, you know, their immune system attacking them. So this is a you know, a condition that affects all groups of, you know, whether you're young, old, black, white, you know, rich, poor, everyone gets affected with this condition. And, you know, my goal as a dermatologist who focuses on hair loss is to try and continually come up with better treatment options.
Yeah.
Because for the past 10 years, not a whole lot has come up.
Yeah, that's
know.
very true.
Yeah, unlike, you know, cardiology where your heart or your liver, there's a lot of research going in that area.
Right.
But hair is considered, you know, not as
Like a luxury item
like
of the body.
Exactly. So there's not a lot of research,
Yeah.
you know, done by the federal government. So we don't have a lot of treatment options.
Yeah.
This is why I'm so excited that, you know, this new treatment, platelet-rich plasma, or PRP, is, you know, proving to be very effective for a lot of my patients.
Wow, that is awesome. And if somebody wants to do the PRP treatment, how long of a process is it?
Very good question. So typically, you know, you come in, I do an evaluation to determine if you're a candidate for the treatment, because we have a whole lot of other different types of treatments.
Okay.
First, I have to determine if you're a candidate, right? And then if you are, we set up an appointment to have it done. You come in, we draw your blood, just like you would go to a lab to get blood drawn.
Yeah.
We spin the blood in a machine called a centrifuge, and we separate out just the pure growth factors.
Okay.
And then my nurses come in and we inject it into the areas where you're thinning. This is a part, you know, we numb your scalp, but there's just a little bit of discomfort still.
Okay.
My nurses are trained in this. They're wonderful. They will talk you through it. We have music.
Oh, good.
We have candle, you know, we have a little candle, scented candle, just to make the ambience really, inviting and
Yeah.
make the best out of it.
Good, good. Because I know any kind of medical procedure can be scary, especially if you've not had anything done like that before.
Absolutely, absolutely. It's most of my patients, who come in for the first time haven't had much done, and we have to tell them, you know, the process and, basically hold their hand through the process.
Okay.
And then there's a whole bunch of patients who come in and get injections every week at my practice, hundreds and hundreds of patients. Because I probably have one of the largest hair loss practices in the area.
So if somebody is getting that treatment, they're coming in on a regular basis to get these injections.
Yes, typically we recommend getting the injections once a month for 3 treatments.
Okay.
And then we watch what results comes from that, and then we might recommend a maintenance regimen of doing the treatment every 6 to 12 months.
Okay.
Yeah.
All right, and it's very dependent on the patient, I assume.
It's very dependent on, that's our usual regimen.
Okay.
The protocol is pretty standard.
Okay.
The earlier you are in your hair loss, the better the results.
Okay.
If you wait till there's barely any hair there, you're not going to get as good a result as you could get if you attack it early.
Okay.
Okay.
So early detection is good. So if someone is worried about their hair, they can call, make an appointment.
Yes, call, make an appointment, and let's do a consultation. Because, like I said, not all hair loss is genetic or stress related. It could be autoimmune. It could be hormonal. It could be nutritional. We make sure that we address the medical problems.
Okay.
If you're losing your hair because you're iron deficient, I find that out. If replacing your iron is all you need, I'm not going to give you PRP.
Right.
Right?
Of course.
So we do our due diligence and make sure that, we figure out why you're losing your hair. And if it's something easily fixed, like replacing iron or nutrition, we do that.
Okay.
If it's something that's more along the lines of PRP, we have that option as well.
That's awesome. Well, thank you so much for being here. If you guys have questions for Dr. Che, make sure that you put them in the comments. We'll make sure we get those answered. And if you're experiencing any kind of hair loss in your life, or you know someone who is, make sure you call Cosmopolitan Dermatology to make your appointment, get that consultation, and figure out what's going on. So thank you again for being here.
Absolutely. The phone number is 216-417-3250.
Great.
So if you want to call for an appointment, that will be the number to call.
Awesome. Thank you so much.
All right.